Good morning and welcome to today's webinar hosted by the New Jersey HFMA and EnableComp to discuss workers' compensation billing for hospitals. My name is Allie Connor and I just have a couple of items to review before we begin. This is our first webinar in partnership with the New Jersey HFMA regarding workers' comp, and we're honored to be asked by them to speak to you today. This webinar is being recorded and your line is muted. We encourage you to ask questions throughout the presentation and we will answer as many as we can at the end. I'm excited to be able to introduce our speakers from EnableComp today. Hamilton Bowman, our Chief Operations Officer, and Jesse Larison, VP of Managed Care. Between the two of them, they have over 30 years of total workers' compensation experience and knowledge. I'm pleased to have them with us today to provide some work comp education and best practice tips to our hospital billing departments in New Jersey, as well as sharing a few key points with us that will help us all tame the work comp pay class and be more profitable in the process. Before we jump into the details, I would like to introduce Patrick Smith, VP of Client Services, to give you all some context of who we are and what we do. Patrick, are you with us?
This is Hamilton. I'll fill in for Pat. Thanks for the intro, and it's great to see so many of our friends in New Jersey on the call today. For those of you who are not familiar with EnableComp, we are a full-service revenue cycle management company that exclusively handles workers' compensation claims for hospitals. We service over 600 hospitals nationally, including several in the state of New Jersey. Our focus is to provide more revenue per claim, eliminate payment delays, get you paid faster, and reduce your overall AR in the workers' comp financial class. If you want to learn more about EnableComp and our services, please reach out to us after the webinar, and we'll be glad to be happy to answer any questions you may have. And so with that, I want to turn it over to Jesse Larison to get us started.
Thanks, Hamilton. Thanks, Allie. Appreciate it. Well, welcome, everyone. Excited to be here today, and big thanks to the New Jersey chapters of HFMA to have us join you all today. Whenever I talk about workers' comp to hospitals and billing operations, I always try to give a little context. I think it goes a long way to establishing best practices for work comp revenue cycle. And since work comp is pretty much an unknown to so many folks within the billing world, let's just briefly talk a little bit about what it is and how we got here in the first place. So everything basically started about 130 years ago in Germany. In 1884, the chancellor introduced a mandatory state-run compensation system which paid benefits out to injured workers for up to 13 weeks from a pool of finances that was put together by both the workers and their employers jointly. And it worked pretty well. And here in the U.S., there were some voluntary laws in place around the country that gave some protection to workers, but it really wasn't until the Triangle Shirtwaist factory fire in 1911 that killed over 130 people that things started to change, especially in New York. And as a result, New York, along with many other states, made changes to their constitution, introduces legislation. There was a lot of action happening to really make room for this type of occupational injury protection. And by the 30s, almost every state in the country, except for a few, had enacted some kind of work comp reform. And in 1948, Mississippi was the last one in to put together work comp regulation, really creating what was the first national social insurance program, and that even predated Medicare and Medicaid. So for those on the call, on the hospital side, familiar with these larger, pay classes, Medicare and Medicaid, work comp really is the first one of its kind to offer this type of regulatory reimbursable amount for injured workers. So work comp today, it's called the grand bargain. That is the term used to refer to what work comp is. And essentially what that means is the grand bargain is between the injured worker and their employer. And that means, you're going to take care of my work comp injury, and I'm not going to sue you for negligence. And we don't see that elsewhere in the world. But within work comp, that's the deal. And there's a few nuances around the country where that doesn't occur, like in Texas and previously Oklahoma. But for almost every state in the country, the grand bargain holds true. This system works pretty well and gives employees confidence to show up to work every day and do potentially dangerous things, and it motivates employers to spend time and money on safety training and accident prevention and things like that. It's a big deal. The program has grown to over 3 million workers' comp claims every year, and over $92 billion in benefits paid out. So it's a massive system. Now, the wild thing about this state-run entitlement program is it's not federally regulated. It's a big state-run program. Every state is different in how they handle work comp, and the rules change from one state to another with respect to things like how claims are submitted, how are injuries reported, what services need to be pre-certified before a hospital can get paid, how are bills issued, and in what manner, and to whom can all be different from state to state. So it's pretty complex, and some states are pretty lucrative for hospitals on the work comp side, and others barely pay cost for certain procedures like physical therapy or radiology. So the good thing is, unless your hospital or your health system spans multiple states, you really don't need to learn all the rules and regulations like my company does. You can focus strictly on the ones that impact the majority of your work comp volume, like New Jersey, for example, or maybe the surrounding states, and maybe the Department of Labor would be good enough to cover, the bulk of your work comp claims. Learning those is what you're going to need to do in order to excel at the work comp revenue cycle.
Yeah. But this seems like a lot of work, right? All those different complexities with workers' comp. Let's face it, workers' comp is only 1% to 2% of a hospital's payer mix. It seems very complex, continuously changing, very dynamic, and a lot of times we see it requires full-time, dedicated staff to handle the volume. And I'm sure most of you on the phone can realize that. In some cases, we've seen up to 10% or more of the entire hospital billing office touching workers' comp volume in one form or another due to the paper-based and manual processes involved. Now, that's a lot of internal labor for the revenue that it brings, and it's oftentimes a losing battle. The workers' comp payer community spends many millions of dollars each year on cost containment. And so hospitals a lot of times are at a distinct disadvantage. The payers are better informed. They have invested in great tools in some cases, and they have dedicated staff that is focused solely on reducing the amount they have to pay on workers' comp bills. And they know that a lot of hospitals don't have the time or resources to get them to pay more. So, Jesse, the question for you is winning at workers' comp hospital billing a lost cause?
It is not, Hamilton, and we'll tell you why. It can be done. You can win at it. It can be done well by hospitals, and there's some basic principles that we've put together here that should help any hospital within New Jersey do work comp well. And really, it starts by asking yourself 5 basic questions. Where do I send the bill? How much am I owed? How do I send the bill, which is very different? And how do I measure the success of my program? And the last thing is this something I want to own? Should I keep this thing? And we're going to talk about all those different things and the implications. But if you start with where do I send the bill, it's probably the number one problem within work comp is getting that bill to the right place. Over half of all the bills that are issued for workers' comp go to the wrong place straight out of the gate. Now, there's a whole lot of reasons as to why that is, but the fact of the matter is getting the bills to the wrong place initially results in payment delays of up to many months. Insurance companies are now returning denied claims that were never theirs to begin with. Hospitals have to investigate who the correct payer is, track down the address, rebill, and just hope they haven't violated timely billing laws or other types of payment of issues. And at best, the hospital gets paid much later in the cycle than they should, and at worst, they get a complete denial. So solving the problem really starts with the intake. And the number one thing we can do is to work with the registration department on identifying essentially 2 key pieces of information. Number 1, did this injury happen on the job? And number 2, who is the employer? That's number 1 and number 2. If the answer number 1 is yes, you got a great likelihood that you are dealing with a work comp claim, and you need to get the correct pay information and send the bill, and then potentially authorize the procedure per New Jersey regulations. Now, you got injured workers that are presenting to the emergency room. It's very important to ask who their supervisor is. This will allow you to be able to contact the employer, speak with the supervisor, especially if the patient is unable to get you that correct insurance information. Now, we have a form that we use. We train our hospital clients on how to do work comp intake properly from the registration side. It's very valuable to do that on the front end, and I would recommend anybody on the call creating tools like this, as simple effective on the front end, and they definitely generate results on identifying the correct payer. Now, most injured workers and supervisors have no clue who their work comp carrier is. They don't show up with a work comp card. So getting the employer information is the best way to start down the road if you can't get that. Now, a lot of states will have a database that allows you to search carrier information tied to payers. New Jersey has one as well, and it's www.njcrib. And for those that are on the webinar, you can see we've got a screenshot up here of where you go to search for policy coverage. And if you click on that link, it'll ask you to input the employer information and the date of injury, and it'll tell you which insurance company is covering that employer for work comp at that time. It's a great way to identify where I need to send bills. So, number one, sending the bill to the right place. These are some key steps that we can use to identify who the correct payer is. Now, the biggest part of getting paid after you've identified the payer is making sure that that treatment is authorized. It's a big hang-up in work comp that the lack of authorization, and I can tell you hospitals across the country struggle to obtain this information properly and keep a record on file to deal with the inevitable payment denial which comes later on for no authorization. Now, New Jersey requires that treatment must be authorized by the employer or the carrier prior to services being rendered, so it's very important to get that authorization consistently.
Thanks, Jesse. Another key question that hospitals ask around workers' comp is, how much am I owed? And believe it or not, we see that insurance companies pay hospitals the correct expected reimbursement amount less than 70% of the time. If you don't know what to expect, you'll spin your wheels appealing payments and miss other opportunities in the process. While some portion of your workers' comp patients will have claim jurisdictions outside of your state, along with federal employees and other anomalies, the vast majority of your workers' comp claims should be paid pursuant to the New Jersey prevailing community rate. Most border states, such as New York and Pennsylvania, publish this rate information on their website free of charge, or it can be purchased from a data supplier for a few $100s. Modeling the correct amount for your expected reimbursement is well worth the time and effort on the front end to make sure that you're being paid accurately and appealing the correct claims on the back end to maximize your reimbursement for the workers' comp financial class. But we understand that this is a struggle. Because of the New Jersey statute, we call it a Wild West environment, and the prevailing community rate is a gray area at best based on our knowledge and expertise. Getting paid different rates for the same service by different payers is very confusing. Our recommendation is to study it internally and establish a position as to what prevailing community rate means to you. For example, you can average all of your workers' comp managed care contracts and set a baseline. You could also average your commercial rates to give payment expectation even more validity, or go as far as utilizing a broader data set that you can get from places such as Optum or Fair Health, something that would be in a defensible position for how you're calculating your workers' comp reimbursement. Go ahead and establish now your workers' comp threshold by which to appeal and get paid on underpayments that you want to pursue.
Thanks, Hamilton. That's critical to do for all the hospital CBOs that we're talking to. And at this point, I really want to make sure that if anybody has any questions, go ahead and enter that into the Q&A section of the webinar, and we'll try to address as many as we can at the end. And we'll try and follow up with you if we can't on the webinar privately afterwards. But the third thing we want to talk about is getting the bill sent properly. We talked about where to send it. We talked about how much to expect. Talking about where we should send the bill is really important, and how we should send it. So almost every state allows payers to deny work comp bills that are sent without supporting documentation. And unlike group and commercial carriers that focus really on eligibility, work comp is all about compensability and relative treatment. It's really important to understand that when you're separating work comp from the rest of your pay classes. So sending appropriate records and cost documentation along with the medical bill is going to drastically improve your chances of getting paid correctly and quickly. So don't just wait for a denial for documents. Go ahead and send them initially, because most payers are going to always deny a work comp medical bill that's sent without documentation. So make sure that you do that. Now, I understand that surgical implants are a point of concern for providers, especially in New Jersey and other UNC states where it can be really a significant portion of the bill charge is tied to that 278 rev code. Now, if you're unwilling to send implant invoices, there may be situations where no payments on implants are going to happen. So it's really important to develop an internal policy on how to deal with implant cost documentation. I can tell you, Hamilton, you could probably agree, dealing with implant cost documentation across the country is a struggle for hospitals.
Yep. So we see it with most of our clients in almost every state. They struggle with how to maintain and make sure that the claim is submitted the right documentation, and implant invoice is a key component of that.
Absolutely. And in states like New Jersey that are essentially unregulated in how implants are reimbursed, it's a gray area, and it's an opportunity for payers to look for underpayment positions. So our recommendation is, in New Jersey, develop that internal policy on how to deal with it. The payer community is moving faster and faster toward universally requesting implant invoices and other cost documentation to make payments. And new companies are popping up. There's companies out there like Foresight Medical and Paradigm Outcomes, and all they do is focus on surgical device cost containment and high-cost components in ortho and spine care. So it's very important to understand that is a big denial opportunity for the work comp payer class, and the hospitals on the call need to have a way to respond to whether or not they're going to send those invoices out and try and pursue those payments. So beyond implant invoices, how we're going to send the bill is key on the electronic submission. So let's talk about electronic submission for medical bills, which is really, it's quickly becoming a requirement almost everywhere. Over half of all the work comp payers accept work comp claims electronically now, and many can pay work comp claims via electronic means. And states across the country are starting to require hospitals to submit claims electronically. So, if we're talking about compliance, that's one thing, but a 20% reduction in days to pay is pretty good, Hamilton. And New Jersey is quickly becoming the next state to require that. So New Jersey will be the 5th state in the country to mandate electronic billing for hospitals for all work comp claims. So let's backtrack a little bit to 2016. Governor Christie signed Assembly Bill 3401 into law, which would require work comp providers to submit electronic medical bills. Now, this law will take effect after the Labor Commission establishes rules that will carry out its provisions, and it's expected there will be a 6-month grace period to allow everyone to get up to speed after the law becomes effective. But I will tell you that the benefits of submitting bills electronically are so profound that waiting for the law to go into effect just to become compliant isn't really doing you all a whole lot of favors. And our recommendation, and Hamilton, you probably agree, is every hospital should be considering submitting bills electronically for work comp because of the increase in days to pay, the decreased denial propensity, the speed, and the cash acceleration, right?
Absolutely, and that kind of brings us into our next topic on how do you measure success in workers' comp revenue cycle management. We could spend a lot more time than one lunchtime webinar going through measuring success. We thought it was important to go through with you a couple of metrics that we use to manage success in workers' comp. Most hospital internal revenue cycle teams set billing and collection goals for their larger payer classes. And just because workers' comp is a small piece of the pie, if you will, it doesn't mean that it should be free of scrutiny and be mismanaged. And so here are a couple of basic principles that every hospital business office should adhere to when billing and collecting for workers' comp. The first is, days to payment in full. Go ahead and determine what time frame is reasonable for you and your shop to get paid 100% of what is owed and measure your team to that standard. 90 days is about average. We've seen a lot of hospitals, as you know, Jesse, that have gone way beyond 90 days to pay, but 60 days is a good target and an admirable target for workers' comp.
Yeah, and I will say in a state like New Jersey, which is a much more difficult state to peg the correct expected amount, there's a lot of dialogue between provider and payer. 60 would be very, very good, and any CBO that's measuring 60 days in New Jersey is really winning. So, I don't want the folks on the call that are looking at their days to pay and they're looking at 120 or 180 days to think, poorly of the performance. I think that's very reasonable in New Jersey to have that high. But these these practices that we're talking about can get you into closer to that 60-day high mark, and
yep.
90 being, acceptable as well in New Jersey.
Yep. Another key metric is AR management. Without a plan and without disciplined management, workers' comp claims can age, in a hurry. So it's key to set some boundaries on what you will allow in the over 90-day bucket and try to limit that percentage to less than 30% of the total being less than 90 days old. Our best practice standard that we report back to our class is 20% or less, which is, what is acceptable in a lot of other payment classes, but is extremely hard to achieve in workers' comp, due to the oftentimes manual and paper-based nature of the workers' comp business. All right, Jesse, so let's look at some factors that folks should consider about whether or not to keep this in-house.
Yeah, let's do that. And before I do that, I want to jump back real quick to the New Jersey ebilling update. One thing that I wanted to talk about was where we are specifically with the rule. This is a fluid situation, and we've had some questions that have come up about, hey, when does this actually become mandatory in New Jersey? As I said earlier, the laws went into place in 2016, but right now the public hearing period for the rulemaking has ended, and we're all kind of awaiting the final adoption of the rules, which really could occur any time. So I don't want to characterize that ebilling is mandated now in New Jersey, but it is coming. We're kind of all awaiting when that's going to occur. So I just wanted to make sure that we didn't forego that information and mischaracterize where ebilling is in New Jersey. And we can talk about, we can talk about having a separate discussion later on about ebilling specifically for work comp. There's a lot of things. We've done webinars about ebilling before, but I want to make sure that everyone understands that it's not as mandatory as of right now, but it's coming. So, okay. Talking about owning work comp, we see hospitals across the country that do work comp very well in-house, and they apply these best practices, and it's good to see that the providers can be successful at work comp, even in difficult states like New Jersey. But measuring success is critical to the program, and the questions we have to ask ourselves is, if results are not improving or we've got obstacles that are preventing us from winning at the work comp game, we get it. Work comp is a small piece of the business. It's very easy to get distracted. It's very difficult to apply labor to the work comp billing side. It's very difficult to apply the management properly. So it's easy to see why so many hospital CBOs bring in an expert partner to handle work comp billing. Now, we said earlier that work comp can occupy as much as 10% of an entire CBO's resources, while really only delivering 2 to 3% revenue. And so depending on what your revenue cycle budget goals are, outsourcing may or may not be a good fit for you. Things that you want to ask yourself and consider before making that call is, let's start off with who's handling my work comp now, right? Who are these billers? Are they my best collectors? And if they are, would I be better served if they were going after my large commercial claims, my larger, more complex claims? Those are some questions I want to ask myself as a CBO manager. Now, does my systems, what are the tools that I have to work claims, okay? Does my system allow me to build and model my prevailing community rate? We had a question that came up earlier about Epic, and there's a lot of systems that are on multiple different programs to try and model and process billing. Can I work comp within that environment, or do I have to do a whole lot of extra stuff to make it work? Can I model my prevailing community rate, and what about maybe my neighboring state fee schedule, right? Let's say I've got claims coming from New York or Pennsylvania or Maryland. What about Department of Labor? I think we've done analytics. Hamilton Department of Labor is probably the 6th largest payer for occupational injury in the country. So we know every hospital is seeing DOL claims. DOL is its own little world. It's the 51st state. So how do you model DOL claims? You can't treat them like New Jersey claims, otherwise you'll be spinning your wheels. So do I have tools in place that allow me to model those different things? And those are questions I would ask. Can I price PPO contracts and contracted discounts appropriately? In states like New Jersey and Virginia and Missouri and other states where there is not a lot of regulation around hospital reimbursement, PPO contracts are huge. And Hamilton, you know as well as I do, our New Jersey-based hospitals have dozens of PPO contracts. It's very complex to understand when a claim comes in the door, which discount is being applied, which PPO it's coming under, and how should that impact my business? What if my discount is a percentage off the bill charge, yet I'm seeing other types of discounts on the bill that aren't contractually agreed to? How do I rationalize the discount that was taken on the bill versus what I've actually contractually agreed to? And I'll tell you, as a managed care guy myself, I've modeled probably hundreds of contracts, and I'll see payers that will take the contractual discount, and then they'll also add additional discounts which were not originally agreed to. And it's very difficult to be able to identify what you as a hospital have agreed to and what you haven't in working those type of appeals. So the question is there, do I have the tools to be able to identify what the payer is doing within my system? And I guess the last thing is, am I compliant with state laws regarding my work comp? We talked about ebilling coming up, right? That's something that every hospital should be paying attention to. We talked about authorization. We see time and time again hospitals missing out on major revenue because they did not get services authorized on the front end. That's an easy fix.
You've definitely highlighted the complexities around workers' comp and things that every hospital should consider. And the fee schedule is complex, especially when you look at the PPO contracts and different elements of it. But we've mentioned a couple of times that workers' comp is 1 or 2% of the revenue, but we can't forget that it's also a very high margin compared to other business lines.
Absolutely.
And so you want to make sure that whatever you do, either in-house or use a partner, you want to make sure that you maximize reimbursement because the margins there are higher than a lot of other financial classes.
Sure, especially in states like New Jersey.
Absolutely.
Which really provide for good margin for most hospitals. Reporting is something that I would definitely talk about. If you want to measure success, it's very important to understand what your reporting capability is. And I would say that it's very difficult to identify tools that give you success, that show where your work comp program is. So when you're asking your questions about your billers, about your tools, am I meeting my goals? Am I able to measure those goals? You really want to be able to say yes, yes, and yes as you grow your program. If you're seeing a lot of no's, you need to start looking at a partner to come and help you with that. And there are great partners out there that can help you with work comp. So we talked about some 5 basic questions. We've got some good questions already in throughout the presentation, and we'll address those in just a few minutes. But the 5 basic areas of focus for any billing office interested in excelling for work comp. And I'll tell you, for those that are doing those now or plan to incorporate some of these principles into your program, they do produce real results. And what I don't want to do is to characterize, hey, these are some great questions, but we don't know if they really work. I'll tell you, after 15 years of experience, we've seen some pretty dramatic results. And, Hamilton, we've analyzed benchmarks for a long time, and you can tell as well as anybody, when you dig into the performance on an unmanaged program and compare it to a best-in-class program from the exact same state and even the exact same health system, you see some market improvement. And the way you can tell if your work comp program is working just beyond maybe an increase in your collections or your AR is reducing is look at the change in your days to pay, and then look at the payment amounts compared to what your original expectation was. So we talked earlier about setting your expectation for what you should get paid in New Jersey, and we talked about how long it's taking to get paid. By applying those best practices that we talked about, we should see the first one shrink and the second one expand. And I'm showing you a case study here of a single health system that went from, we'll call it an unmanaged program, to a managed program. And they moved the top 20 payers for their work comp pay class across the spectrum. And I'll tell you that in work comp, there are lots and lots of players and employers, but there's really your top 20 payers are going to represent almost 75% of all your revenue, okay? So don't get bogged down by the fact that you may have 300 or 400 different payers coming into your hospital system throughout the course of a year. It's going to be 10 large carriers that are going to drive most of it, and certainly the top 20. But this system here, and I'll tell you, this is a case that is indicative of what we see across the board when you apply these best practices, is they're moving their top 20 payers across the bottom axis from days to pay. You can see, large carriers down there, Travelers, Zurich, AIG, in the 100 days to pay, and you can see Travelers has moved all the way over up to, 40 days to pay. So it's pretty amazing to see them move those guys across the spectrum, really accelerating cash by over 20%. And on top of that, increasing the payments versus what they expected by almost 10%. So a 10% increase in revenue and getting it 20% faster for the same book of business is pretty outstanding when you think about the potential impact for work comp revenue just by focusing on a few key components that we covered today, right, Hamilton?
Exactly.
So we talked about the results of applying these best practices. I think it's important to answer questions that we have, and if we can't get to all the questions here today, then, we'll certainly try and follow up afterwards. But Allie, do we have some questions that we want to share with the group?
We do. So the first question that we have is, what is the time frame to get a work comp claim paid, and how long do you have to get the claim to the insurance company?
Right now, there are not time frames within New Jersey to issue the bills around getting a bill to the payer. I will tell you that if you want to invoke the dispute resolution process with the state, there's a 2-year time frame on that. But it's a good question.
All right. Second question, is there a timeline of when the ebilling mandate will take effect?
Ellie, not at this time, but we're monitoring this closely by monitoring the New Jersey Register for changes, as well as local clearinghouses, regulatory officials, et cetera. So as soon as we know something, we'll make sure we share it with the New Jersey HFMA, make sure folks are duly notified.
Okay. How do we deal with UNC payment reductions?
UNC payment reductions, well, that's the million-dollar question. And in non-regulated states like New Jersey, we get that struggle. We talked about that earlier in the webinar, identifying where you want to set your expected rate. And it's probably a completely separate webinar in and of itself on how to peg expected, how to determine what PCR is. But I'm going to share a few bits about that. So Virginia just went through this, and some of them on the call may understand that Virginia also is a prevailing community rate state. And they decided to invoke a fee schedule. They spent quite a long time on developing it, and it just went live last month. But they did it because, for the same reasons that we all struggle with identifying what is usual and customary or what is prevailing community rate for work comp. And they had a massive amount of conflict that occurred between the provider and the payers, just like what happens with our clients in New Jersey. And the best practices that we discussed here today are really designed to mitigate those underpayments in work comp, but you're always going to have employers and carriers and occasionally bad actors on the payer side that really try and take advantage of that lack of regulation around provider reimbursement. So, how do you deal with UNC underpayments? Well, my team has a very detailed SOP that they follow for how to address claims, and it's somewhat complex, but we've developed it for our day one billing clients in the non-fee schedule states like New Jersey and Virginia, and Wisconsin and Missouri and Arizona as well. And I'd recommend that each hospital kind of create something like that. Essentially what you want to do is put together what is your usual and customary appeal strategy for the underpayments. And you can typically identify that an underpayment for work comp really is UNC and not something else, because it's going to be notated in the reason code on the EOB. So take a look at your EOBs and look at the bottom, and you're going to look for something that says, reasonable or customary denial applied, or prevailing community rate reduction applied, or something like that. If you see things like denied for documents, or we need the implant cost documentation, or this is a reduction per PPO contracted discount, that's not going to be your usual and customary reductions, so don't get confused. But if you see that reasonable customary, usual and customary, or prevailing community rate is being invoked, or the adjuster or the carrier is telling you that on the phone, then you really want to begin using your appeal strategy to the expected that you've set that we discussed earlier. And I would set a timeline on how many appeals you send, how you escalate them throughout the carrier, the chain of command, talking from supervisor to manager. At what point do you bring the employer involved? Because in many cases, the employer itself is completely blind to what's going on in the payment cycle, right? The employer, who really has the fiscal responsibility to pay the claim, has brought on a TPA and an insurance company and a potentially third-party biller to work on their behalf, and those billers are really incented in reducing the total cost. So the employer has no idea; they're not visible into what's going on. So bringing the employer into this discussion at the appropriate time can be effective in making sure that, at the end of the day, we provided a great service to you as your injured worker, and, we're struggling with your carrier to pay appropriate amounts on the bill. It's very important to do that. So the chain of authority is important. I would also say that making sure you've got your better billers working these type of claims, especially if they're large balances. This is a difficult negotiation sometimes. You want to make sure that they know exactly how to communicate with this usual and customary reduction and how they can communicate what your established benchmarks have been for what is expected from my hospital. Like I said, we talked about earlier, but building credibility. If you can build credibility by saying, hey, we have established a baseline for work comp, this is what the prevailing community rate is, and this is why we have developed it. It'll make things easier. Now, I'll say that works a lot of the time, and there are times that you really need to bring in some extra guns, extra resources, and we've seen success with this as well. Sometimes we'll bring in hospital general counsel to issue a demand letter or get involved and just kind of escalate the sense of urgency on getting these claims paid appropriately. So if you have that ability, I would definitely do that. Obviously, if you don't have that ability, then there's costs involved in that, and you want to make sure that you understand that you don't apply this to every balance and every claim. But some payers will respond well. Others are going to force you to pursue them legally. Now, New Jersey does have a formal appeals process for providers that want to seek additional payments. And for those that are on the webinar, I can send you the link to how to do that. There's a form. It's called the WC-381, and you can fill that out and submit it to the New Jersey Department of Labor and Workforce Development. And that is a formal application, and it'll evoke an informal hearing process and move toward a formal one. You will need to have counsel represent you, and it'll get in front of an administrative law judge to move forward with that. But I'll tell you that New Jersey, just like Virginia, is absolutely overwhelmed with these type of provider requests. And I'm not convinced that they are really successful for providers to go down this route. So I would say, be very careful on how you pursue those, develop what your appeal strategy is going to be, and go through that chain. And at what point do you settle and close out claims so they don't negatively impact your AR and just hang around forever? Yeah.
All right. Another question that we have here is, what if our work comp bills are denied completely?
Thanks, Ellie. That's one.
That never happens, right?
Well, Jesse's probably seen a few of those in his day. I think we all have. And I think this kind of builds on the previous, question and answer that Jesse gave. When a claim is denied completely, there's usually a good reason for it, and they're usually something that we can solve. So the first step is going to be to evaluate that EOB, read the reason code at the bottom, to figure out, why was this claim denied. We see that a lot of times when a claim is denied in full, that it's a lot of times it's a result of missing documentation. She might have to resubmit the bill with a copy of medical record documentation, itemized statement, maybe an invoice, but that EOB can give you a clue in those. Sometimes there was no authorization on file. We see a lot of times that there was a coding issue on the bill, or the employer payer denied it, due to compensability issues. And so what we like to utilize here at EnableComp is a clinical review team to look at these denials from a compensability standpoint, from a coding standpoint. And so I'd recommend that anyone out there reviewing these denials and these complex claims, and make sure you have good clinical and coding resources, ready to look at these and figure out the best way to resubmit some of these complete denials.
Hamilton, I'll chime in on that. We recently had a claim that came through with the complete denial, and it was a compensability denial. And essentially what happened was there was some confusion as to whether the injury occurred at work, but for sure there were some pre-existing conditions involved. And without the proper tools, the payer automatically just denied the bill for compensability. It's the easy thing for them to do. And by looking at that claim and by explaining to the payer, hey, that the treatment that was rendered for this injury was completely separate from the pre-existing condition, the payer understood what we were communicating to them, and agreed to go ahead and pay, a third of the bill. So we apportioned the bill for them, and they subrogated with the other payers. But it netted a $300,000 payment for the hospital, which would have been a giant delay in payment. It would have gone to the group carrier, and they probably would have denied it as well, saying, no, it's work comp, and we see this all the time. So having, and it's great that the hospitals have clinical and coding resources available to them. What I don't typically see is hospitals identifying folks within their clinical teams and their coding teams that have any work comp expertise that they can bring in for these complex claims. And I would recommend that every hospital tag one or two people to say, hey, when I get a claim that's a high-dollar claim and they're being denied for a compensability, why not take a look at it and give me your thoughts? There's a lot of talent available within the hospital groups that can provide insight to getting some of these things paid. Now, our team does it. We've seen success with it, and it's a great way to mitigate some of those complete denials. And you may not get a complete payment, but I think everybody will take a $300,000 payment over zero any day of the week, and we see that pretty consistently. It's a good question, though.
Another question is, what if I'm a hospital on the border and I treat patients who live in other states? How does your system handle that?
Well, we kind of briefly touched on that earlier, and that does occur, right? So we have what we call an out-of-state matrix, which is loaded in our system, but that's because we process claims in 40-some states. So, but if you're in New Jersey and you're essentially dealing with out-of-state claims, primarily from New York and PA, and you may get truckers that get injured while they're transitioning through New Jersey and they're from Florida or whatnot. It's not that difficult to identify how another state's going to pay you. I'll tell you that it can be rewarding if you know what it is. And we talked about Department of Labor earlier. I don't want anyone on the call on the webinar to try and think that Department of Labor is going to present them with a great opportunity. Okay. For anybody that's worked DOL claims, they pay Medicare plus a small percentage, and they will not pay a penny more. Denials that come from occupational injury for Department of Labor, the only type of success we see with DOL is really tied to things like accepted conditions, getting those added to the file, working with the case manager at DOL. So you can fix DOL claims from a documentation standpoint and maybe getting them to add something, or faxing in an authorization or approval, but you're never going to get them to pay anything close to prevailing community rate. So don't even try and do it. You'll waste a whole lot of time appealing DOL claims, and there's other hair on that. We can probably talk about Department of Labor in a separate webinar.
Separate call, right?
You're right. Yeah, hospitals have to be credentialed. It's kind of a mess. So I wouldn't work on that. But as far as Pennsylvania and New York and your surrounding states, if you go to their websites and download the work comp rules, they will almost always talk about how they pay claims outside of their state. New York is a little conflicting. They say that it depends on where the patient lives. Pennsylvania relegates it to a particular zip code in Pennsylvania. But the bottom line is, if you know how your neighboring states are going to pay you, it puts you in a great position of negotiation with the payer, who may come and pay at the lowest rate. And if, for example, New York says, hey, this patient is living and working in New Jersey, and we're going to pay via the New Jersey fee schedule, it's a lot better. The New Jersey PCR, it's a lot better reimbursement than what your New York rate's going to be, which is pretty low. And most of the folks on the call that treat New York claims have probably seen what that low APR DRG reimbursement is. It's miles apart from what New Jersey pays. So knowing what those are is really important to make your appeal strategy good. And I would recommend to go ahead and research the states that you see most often and have those in your bag of tricks. So when you have a denial and they're saying, well, this is a New York jurisdiction claim, we're going to pay it via New York, you can respond accordingly based on the details of the claim. That's a good question, though.
And can we bill the patient if the employer does not pay the bill?
Hamilton, you want to do that, or you want me to do that one?
I'll do it.
Okay. We all wish we could, right?
Can we bill the patient if the employer doesn't pay the bill? And we get that question a lot, and it's tempting. If you get a small payment on a large work comp bill, it's tempting just to kick the bill to the patient. But unfortunately, that's against the law in New Jersey. If it's a complete denial, let's reference back to the question we asked earlier about looking at the root cause, looking at the EOB, figuring out why it was denied. And if it's a big underpayment that you need to pursue, just move forward with your appeal strategy, reaching out to the payer to try to get the underpayment paid.
Absolutely, yeah. Yeah, do not bill the patient. That's my recommendation at this point. That will create more trouble than it's worth.
Do not.
Even though we wouldn't. So that's a good one. Any other questions, Allie?
That's all we have. I'd like to thank you all for attending the webinar, and a special thanks to Sandy Gabine with the New Jersey HFMA. We hope you enjoyed learning about the best practices in work comp billing, and if you'd like more information or how you can partner with us, you can reach out to us via email at marketing@enablecomp.com, or you can call us at 615-791-4300. Thank you all for joining, and we look forward to the next webinar.